Well, hello. I'm going to go ahead and take this mask off so you can actually hear me talk. But welcome to another one of our community chats or community updates. I'm Steve Long. I'm the CEO at Hancock Health and Hancock Regional Hospital. I'm here to talk to you about what's going on in the world around us, especially related to COVID-19. So the first thing I want to tell you is that we watch the data very, very carefully. And what we're seeing in the data is that the number of new cases has really leveled off now. So we don't have this big growth pattern that we've seen in the past. But it's not really turning downward yet. Now, some places in the country, like New York, thankfully, it's actually going down a bit. We anticipate that that will happen in central Indiana as well, but it's just not quite there. But on the bright side, because the new cases are flat, it's a very predictable growth pattern. So that has given some reassurance, I would say, to our governmental officials that it's time to begin to look for what the next phase in this whole disease process is. What that doesn't mean is that the disease is gone or that the disease is going away. This is something that is part of our environment now. It's going to be with us for quite a while, probably forever, and we're hoping that we will have a vaccine for it, say, in the next 12 to 18 months. But until then, this is a disease that we have to care about, but it doesn't mean that we have to completely shut down the world the way that we have done in the last several weeks. So you will begin to see that there is more and more talk about what do we do next. And we're excited about that because that has an implication for healthcare providers, and that is that there are things that we have put off with patients. So for example, it may be that you're like me and you're over 50 and you need to get that screening colonoscopy. Well, we've pushed those off because they're elective procedures that can wait. It may be that you're a lady that you need to get a mammography, and that's been pushed off as well. So the time has come for us to begin to re-engage with patients and open ourselves up in a way that they can begin to get those services that they need, but that could have been postponed for a while. So please be aware that we're going to be reaching out and trying to help people get back in with our system. This is happening all over the country and around central Indiana as well. Again, it's something we have to do very, very safely because the disease is still there. And you know that we have done a wonderful job in our community and in our county with social distancing. And as those methods begin to abate and we begin to get more open, we expect to see maybe a small increase in the number of people with the disease. But it is something that we can handle because we've built the systems now to do that. So please know, it is safe to engage with your healthcare providers, whether it's Hancock Health or any of the other healthcare providers in our state. Please make sure that you're doing the right thing for your health and the right thing for your family, because now is the time to begin thinking about that. It is safe to engage with us. We have all kinds of protocols in place. We have dealt with infectious diseases for decades, longer than decades, in fact. We've just not had one that was a pandemic in quite a while, but we've got it well under hand. So I hope that you're going to continue looking to us for the information that you need. If you have questions, I would encourage you to call our triage line, our nurse call line at 317-325-2683. You can also email us at nurse@hancockregional.org, or you can go out to our website, hancockregional.org/coronavirus, and you can get more updates there as well. So again, thank you for joining us for this community chat. We wish you a great day.